Good evening. It's Monday, March 18th. Time is 6 o'clock. We're going to call the meeting to order. Next item is approval of the agenda. Motion reads that the agenda for council meeting of Monday, March 18th be approved as presented. I'm a mover and seconder. Councillor Burton and Councillor Young. All in favor? Thank you. We have regrets tonight from Councillor Lockett and Councillor Kirkby, and we have quite a few in the audience today. Welcome, everyone. And we have a presentation, I know, at first, and then we will also have a delegation. So first of all, we just want to make sure number 3 is declaration of interest. Are there any declarations of interest tonight? Seeing none, we're going to move right into our presentations, and I welcome Mayor Jones this evening on behalf of the Leeds and Grenville Lanark District Health Unit. You're going to discuss the proposed merger, right? So the floor is yours. Thank you.
I'm hoping we have the slides here.
Yep.
And I'm hoping more if Dr. Lee appeared. Because her part is first, but please don't worry.
No worries. We won't know.
All right. So thank you very much, everybody. I am a member of the health unit of the health board, and there are 4 of us who are working in collaboration with KFLA and Hastings Health Unit on the merger. And so what we're going to talk about now is that this is an update on what our approach has been and what the next steps have been. So next slide. There'll be a bit of a surprise for you when they come, but please, I'll connect all the dots. So at the same time as the voluntary mergers is underway, the Ontario government has also announced a provincial public health strategy. And they are looking at the role of public health. They're looking at the jobs that they do and have really they taken on more than what was expected. So that's over here. And over here on the other side are the voluntary mergers. Now, if we take our mind back to pre-COVID, when we first heard about these, organizations like ALPHA, which is the Association for Health Units, organizations like AMO, which you're all aware of, we, as a member of AMO, we argued strongly that if we're reading the tea leaves right, and mergers are going to happen, don't force them on us. Let us do our own consultation, our own determinations. So we know that COVID came along. Health units were fighting valiantly every day. Some of us thought maybe they'd forget about the discussion about the mergers, but that is not the case. So the reason that the province is pushing the mergers is they want, first of all, to serve populations of 500,000. Ours is one of the smallest health units in the province. So they feel that 500,000 is a reasonable number of a population so that the economies of scale will be felt throughout the area. It's also a critical mass for resources. If anybody's been involved in any sort of an amalgamation or merger, you know that you end up with other people trained to do the job, backup when needed, and being able to provide that service in an easier way to the people of the public who need it. Our commitment is to maintain our commitment, the government's commitment, I'll get to our commitment in a moment, that they want all frontline jobs and services maintained, and that any cost savings that come about as a result of the merger will stay in the local public health. Next slide. So we've done a proactive exploration. So we are, most mergers are true, but the sizes of our health units along the 401 really required to meet the 500,000 objective. It required 3. So we have Hastings and Kingston, Frontenac, Lennox and Addington, and our own, who have been meeting since they initiated this study. And we continue to do extraordinary work under the leadership of our amazing medical. And I'd like to welcome Dr. Lee. I've done the first slide and I'm just now at what we are doing. I can take you forward today and you can pick it up from there seamlessly.
Everyone. Yes, absolutely. I confess that there is a Dibble Street West and a Dibble Street East. I found that out today, so I apologize. So in terms of what we're planning, so I think there's a few things that I wanted to mention there. One is that we are taking a proactive and positive approach to exploring mergers. It is an exploration. Currently, we're at the phase of feasibility assessment. And really it's looking at what is possible, whether things are a good idea, what it looks like to actually what it would actually look like to potentially merge. So it's not to say that a commitment has been made yet at this stage, although I'll get to the timelines because the timelines are quite fast. In terms of the specific exploration that we're undertaking, so the combination that we're looking at is westward towards, so I'll name the region. So it's the Kingston and surrounding area. The name of the health unit is Kingston, Frontenac, Lennox, and Addington. So it's Kingston and then the two counties on its two sides, which is extends quite far north and includes a substantial rural component. And then the other health unit as well is Hastings Prince Edward Health Unit, which is Belleville and northward in that surrounding area as well. It is quite a large geographical area. I want to acknowledge that. One of the reasons is, I don't know, so let me know if this is a repeat. One of the reasons is because the province has talked about mergers in terms of a population served of 500,000 people or more. Now, to give you a sense of scale, our health unit, the Leeds Grand Ballina District Health Unit, with our two counties, serves about 190,000 people. In order to get to that 500,000, it does, if we go westward with two health units, these two health units would give us a combined total of 550,000. Among the three health units. So to give you a sense of scale, that's what we're talking about. In terms of the reasoning for looking westward, because we do have a variety of health units that do surround us, there are a few things to consider. One is that we do have a history of working with these other two health units in the operational elements of the health unit. So for example, we do a lot of our epidemiological work jointly. We do some of our sexual health work jointly, and we do some of our youth engagement work as well. So those are some examples. As well, we share similar cultures, especially the travel patterns among people. So on the southern part of the LGL health unit, especially people tend to travel towards Kingston for services. Now, not everyone in some substantial part of our population actually travels north and northeastern towards Ottawa as well. Having said that, we do share some common travel corridors as well. So the 401 to the south and then to the north, and oftentimes, especially in the north, people in our region tend to travel east-west rather than north-south per se. And then the last thing that I'll mention as well is that we do have mixed urban-rural geographies among the three health units. So each of us has a larger urban center, of the largest being Kingston, but each of us also has quite substantial rural populations as well, and recognizing that the needs and service delivery for local health units may be different in rural settings versus urban settings, so a common understanding. We have actually created a cross-board engagement structure to look at that merger exploration, and through that cross-board engagement structure, commissioned a feasibility study looking specifically at the combination of these three health units. So some of the nuts and bolts would be, for example, our IT systems. Do they are there overlaps? How might we combine them? Our staffing, where we might have differences or similarities. We are, each of us, highly unionized environments, so what might that look like in a merge situation? And so those things are happening in terms of that feasibility assessment, and then the tribe, or what we're calling the tri-board committee, but really like that cross-board engagement structure is also looking at many other things that might include, for example, what might governance look like in a potential merge structure. And one of the things that we've looked at is on that slide about the principles for the merger. So I won't read through the slides because they're right there. But one of the things about highlights is a joint emphasis from each of the 3 health units on the responsiveness to local needs, and really a sense that we want a merged organization to be better for the population that we serve, the services that we provide, as well as for the organizations as a whole. So all of those things are joint established principles among the 3 organizations in this merger exploration. So if we go to the next slide, so there's a couple of things I want to highlight in terms of moving forward. One is that conversation about board representation and governance. So we do have in our own health unit 6 obligated municipalities and 9 board members currently. In a combined structure with KFL and HPB in particular, I believe we have 14 obligated municipalities in total, and what with the number of other, for example, provincial appointees that are typical on boards of health, it ends up being too large of a board. And so to make them board membership manageable, to be able to do that governance work, there will likely need to be a different board structure. It would be important to maintain representation from each of our obligated municipalities within LGL, including Prescott, for example. But one of the ways in which we would handle sort of the balance of not having too many board members, but also having that representation is something like a rotating membership. So you would be representing a selection of municipalities, and for one 4-year term, for example, it might be Prescott. For another 4-year term, it might be another municipality. And in the rotating structure, that's one of the ways that we talk about it. There are other options, and certainly a rotating structure is something that I understand we've used locally and is typical for other health units that face similar challenges with balancing that membership with the board side. That's one thing. The second thing thank you, is on the topic of changes to the municipal levy. And this I want to be really clear on as well, because I imagine it may be a topic of some interest. So the municipal levies do vary across the 3 organizations, and that's because the municipal levies are independently determined by each health unit. And so there's variability in the sort of per capita amount per health unit, as well as the overall approach to the municipal levy, and that has happened over time, and that's typical of every health unit. What is happening here is if there's a merger that goes forward, when that happens, a single merged organization would need to figure out how the municipal levy works. Typically, there is an equalization or harmonization of municipal levies over time. I want to emphasize over time, so it's not going to happen right away. But it would be certain municipalities paying more to the local health unit per capita than others, and so harmonizing that over time would likely be a principle. And then the second thing to mention is that the province has established dedicated merger funding to health units from now until the end of 2026 and the beginning of 2027. And so over that period of time, the province would cover any changes to the municipal levy amounts that would potentially be increases to these. There are some discussions currently in that cross-board structure, if we go forward with that westward arrangement, of perhaps some municipalities continuing to increase the levy, some small or nominal amount to demonstrate to the province that we're collaborating and we're working on this. But overall, the bulk of that would be covered by the province up until the end of that time. After that, the province has not guaranteed any dedicated merger funding. Having said that, what is also simultaneously happening is starting next year, so 2025, the province has talked about a review of the approach to local public health funding overall. So that's regardless of whether a merger happens, but there would be a review to the overall provincial and municipal approach to local public health funding. And so by the time that is set up, it would be sort of on a roll starting from the end of 2026, 2027 is the estimate. And so both things are happening simultaneously. They're a little bit different from each other, but ultimately the overall municipal levy would be determined by the new board if a merger actually goes forward. So we move to the next slide. Two other provincial initiatives other than the merger piece. And so one is that funding model for local public health, which I just talked about, starting in 2025. The other is the first bullet, which is currently being undertaken. So over the course of 2024, the province is doing a review of the Ontario Public Health Standards. These are the foundational documents that describe the scope and approach of program delivery in local public health units. So for example, the fact that local public health units do rings or inspections of restaurants or falls prevention in older adults as an educational piece. All of these things are actually listed in the Ontario Public Health Standards. The province is undertaking a review, which they do periodically from time to time, on the Ontario Public Health Standards. By the end of 2024, so starting in 2025, the intention is to have these new OPHS standards. And I'll read to you a little excerpt of what they envision. So it's to refine, remove, or shift public health roles and responsibilities to regional or provincial levels is one of the options, right? So not everything would be changed, but there may be some substantial changes coming to the program delivery of local public health starting, by this time next year, for example. And so one of the reasons I want to highlight this is that is happening independent of whether or not a merger actually goes forward. And so it's possible that when we think about mergers, one of the first questions is, will there be a change to local service delivery? And so I want to be clear that as part of the merger, the intention is to improve the organizations as well as the service that we provide. Having said that, simultaneously and unrelatedly is that change to the Ontario Public Health Standards, which may also affect the service provision of local public health units, not just ours, but all across the province. So if we go, yeah, perfect. So this is my last slide around the process and next steps. So right now we're at the point of the feasibility study. And so that has been commissioned and that through that cross-board engagement structure, looking at ourselves and KFLA and HPE. We will be having each of the three health units will be having a board meeting at the end of this month. And so ours is, for example, on May, not in May, March 28th. And during that board meeting would be a decision, which would be an intent to merge decision. So that's not the decision that sort of closes all doors and says we're pitching all forward for for mergers, but certainly is a declaration about the board's intent. And then from there, if there is an intent to merge from each of the three housing units, there would be a business plan submitted to the province on April 2nd. At that time, it would identify to the province that we do indeed intend to merge and the combination thereof. The second, and really critically, is that dedicated provincial funding, what we would request as that dedicated 3-year provincial funding. Now, the province, that's a request to the province, right? The province has to approve it. They also have to change legislation because health units are individually named as part of Ontario legislation. So that would be a response we'd be expecting from them in the summer of this year. There's expected to be a little bit of back and forth negotiation with the province. And so we're expecting to have a further board discussion at the point of then a second decision to say, well, we continue to work on whether merger would go forward, some of the specifics of that implementation. Now we're coming to a point, do we all still agree that it's a good idea? The other critical element is adequate provincial funding to make it actually happen. And then a legal merger, the projected timeline is approximately January 2025, if it indeed goes forward. And then the actual merging sort of integration of these organizations would take time because there's a 3-year merger funding. And so we're expecting over the course of the coming 3 years, and for some elements to be a little bit longer, to understand how our organizations might become a single. So that's the update.
Thank you, Dr. Lee. Great presentation. It's a lot of information for a lot of us. I know Councillor Lockett sits on your board, and she updates us very frequently, so that's good. Is there a lot of health units that are in the same position as you are?
Yeah, so the province, when they started out with this Strengthening Public Health Initiative and these voluntary mergers, what they said was house units that are under the population of 500,000 are being asked to explore. So do exactly what we're doing. I'll say because it's voluntary, not every health unit, I would say, health units have taken a wide variety of approaches to the exploration phase. And so some are, I would say, actually for us, we're probably further ahead than some other health units in terms of exploration. Because the province has said that it's voluntary in that you can choose which of your neighbors you'd like to establish a partnership with. In Eastern Ontario, we're actually, if you can believe it, relatively fortunate in that there's only so many partners we could potentially combine with, which makes that assessment a little bit more straightforward. In, for example, Southwestern Ontario, they're relatively highly sort of networked organizations. Some may have 4 or 5 or even 6 surrounding health units. And so the conversations there are a little bit more complex to navigate. Having said that, there are a number of health units that are sort of all along that spectrum of discussion.
Very good. I'm just going to open the floor to our council for questions. Councillor Young.
Thank you, Mayor Shankar. Just wondering, so with so many balls up in the air, like not even really knowing what the final model is going to look like, it sounds like, what is the challenge that you have to even develop a business?
Yeah, so I think I'll maybe talk about 2 areas of challenge. One is each board is independent. The boards are charged with making the best decision for the region and the populations and the communities that they serve. And so understanding that negotiation among the three boards as to what is the culture, what is the approach, what are the expectations for each of the boards in doing that. I think due diligence, I think that has been a piece of work that's been fairly substantial, and I think Robin could probably speak a little bit more to that. I wouldn't necessarily, I think the discussions have been really positive and but is a process, right? And it's important to do it well and do it right. The other I'll speak to is at the operations level, is really to understand how to stage each of these different components. As you might imagine, these conversations can be fairly can cause a lot of emotions for people in the organization, whether it be curiosity or doubt or excitement or whatever the case may be. And to manage the fact that it takes time to work through each of these things. And in the meantime, there's quite a bit of uncertainty for the organization at a time that we're coming out of the pandemic response and the emergency response, which was already an unusual time for the organization. Coming into emergency recovery and then now into this, there have been, I think, challenges for the organization to understand what it means to continue to provide the services that are important to us, and also manage the work that needs to be done in exploring this merger. And I have to say that the organization has been, the staff have been fantastic, but understandably, it is a disruption. Thank you.
Thank you, Councillor Young. Councillor Campbell?
Thank you, Ms. Schenker. I just wonder if you think that the province kind of has a master plan, a master map on their wall where they're saying perhaps you should be going east. Do you feel that there's going to be some flack about that?
Yeah, I laugh because that this has been part of the give and take with the province. I don't know that I can comment on whether they have a master plan per se, but I do think that the province, so a lot of what they talk about is over the past 15 to 20 years, there have actually been a series of reports about public health units and the delivery of public health services in Ontario. We're relatively unique, actually. We're the only province where public health services are delivered locally through independently governed organizations. In all other jurisdictions in Ontario, or sorry, in Canada, public health is actually delivered either regionally at an arm's length from the province or directly by the province. And so that's the context in which there's been a number of reports, mostly post sort of public health emergencies, so H1N1, SARS, that have indicated that there would be benefit to the province. In fact, explicit recommendations to have fewer health units across the province. And so that's the context in which the province, I think, is approaching this conversation about. Now we're post emergency for COVID-19, and the same sort of, I think, challenges or conversations that had come up in previous provincial structures is now coming up as well. And so the direction, they have explicitly said it's voluntary. So they may have a provincial preference, but honestly speaking, in a voluntary structure, the provincial preference is good to know, but not necessarily ever so.
Good, thanks.
Thank you, Councillor Campbell. Anyone else? Thank you, Dr. Lee. Very good. Thank you, Dr. Robin Jones, Doctor, Premier, Minister, got all of them, I think. Thank you. All right. Back-to-back healthcare today. So item 5.1 is a delegation from the Prescott Family Health Team. Here to discuss is Executive Director, Dr. Denny Matthew.
Okay. So thank you so much. My name is Dr. Jane Mack. I'm the Executive Director of Prescott Family Health Team. And I have with me the physicians from our team. We have Dr. Kilmigos and Dr. Cook. On behalf of my team, I would first of all like to thank the Honorable Mayor and the councillors and of course the Town of Prescott office for arranging this meeting for us. So without further ado, because I was told I do not have a lot of time, there's a lot of information. And if you have any questions, feel free to stop me in between or towards the end. If you have any questions, I would be happy to answer. So the purpose of this presentation is basically to provide background information on how the clinic operates. Now at our location, we have two organizations that coexist. We have Prescott Family Health Team and we have Prescott Family Medical Associates. PFHT and PFME is what we call in short, and how they work together or coexist to provide high quality patient care to our community, the challenges that we face currently and the challenges that are upcoming, and how the towns and these two organizations can work together to find a solution. So as you know, Family Medicine Clinic in Prescott was started as a single physician practice back in 1968. We had been on 20 times. But it was started by Dr. G. Batt, and soon after Dr. Kellen joined the practice, and decades later, Dr. Nikhil Batt joined the duo, and in 2007, they received Family Health Team status from the Ministry of Health. So I will elaborate more on that, but the name of our Family Health Team is Prescott Family Health Team, and it's a non-profit organization. So giving you a little background on what exactly is Family Health Teams. So Family Health Teams are non-profit organizations. They are funded by the Ministry of Health, and this whole concept started back in 2005, to expand access to comprehensive family health care services across Ontario. Approximately as of, actually before the EOI or the expansion information by Ontario Health, there were 187, and now I'm estimating around 200 family health teams at present, serving approximately 3.4 million Ontarians. And the FIT usually focuses on health promotion, disease prevention, chronic disease management aspect of it, with help of their own interdisciplinary healthcare workers. So if you can see here, the family health team does not employ physicians. So physicians are not part of, or they're not the employer of the physician. So all FIT, therefore, have to be affiliated with one or more groups of family physicians. So in our case, Prescott FIT, there are a total of 9 members, executive director, that is myself, my assistant, nurse practitioner, a social worker, a dietitian, 3 nurses, and a receptionist. So important thing here is that not all members are full-time from FIT. So some are 0.5 FTE or 0.7 FTE. And to cover those positions, our physicians complement the rest of the position to make it a full-time position for the employees and make it more attractive for the employees to come and work at Prescott. Talking about our physician group, so there are different ways in Ontario how physicians can work together. One of the ways is by something called as, creating family health organization or FO. In our case, our name is Prescott FO. There are 3 physicians that are part of Prescott FO. Dr. Batt, you may know him very well. Then we have Dr. Matthew Cook. He joined a practice in 2022 and has been caring for the patients of Dr. Kellen after his retirement. And he moved to Brockville from Hamilton with his family and has been commuting from Brockville since then. Dr. Yanis Filamigos, he joined us in 2016, and he has been caring for the patients of former Dr. G. Batt. And he actually commutes from Quebec. So we're really fortunate to have these physicians in our team. And a small business that they operate together is just called Prescott Family Medical Associates, or PFMA. And PFMA is not a for-profit or non-profit organization. It's just a partnership or a conduit organization where, every month physicians contribute from their income to run the business, which is to pay for the expenses for the employees, for overhead. So that's what it is basically doing. So it's a conduit or a partnership organization. And together they care for approximately 5,000 patients. And these physicians are usually compensated using or through their annual capitation payments. which vary by the age and sex of the rostered patients that are under them. And all these patients that are enrolled under these physicians have free access to FIT services, the ones that I just mentioned in a few slides before. So PFMA as such employs a full-time receptionist, a nurse, a billing administrator, a physician assistant, and all the other employees that are, less than or 0.4 or 0.5 or part-time. So they pay for those employees as well. So all in all, our employees become shared. That means they're funded by both FIT and FO. When we talk about overhead costs for these physicians, so these are two major chunks. So one of the major chunks comes from the employees' payroll. So of course, their own full-time employees and those shared employees and other costs. And when I say other costs, that means the payroll taxes, health benefit costs for the employees. So those are all part of the employee payroll. And then there are other expenses like rent, property taxes, utilities, office equipment costs, medical supplies, EMR costs, that's another one, which is a major chunk, and then clinic maintenance costs. Because we exist in the same locations, some of the costs are shared by the PFMA and the FIT, like utilities, for example. And I have to point out here that our physicians also pay for a full-time PA, usually in other teams, because FITs coexist with physician company. Since we hire or we have a nurse practitioner full-time, usually other physicians take advantage or work with the nurse practitioner. But here in our team, we have an additional PA which is fully funded by our physicians. And of course, they also make sure that they pay for or they contribute to make an employee full-time from FIT to FO. And all this is because they consider the needs of the community and of course to improve the access for their patients. So talking about the senior leadership. So when we talk about FIT, we have a FIT board, which has the current positions, and along with that, it has the previous positions on board. We also have community members and myself. So I am responsible for overall direction of the organization, providing that and maintaining the books, the budget, finances, and the human resources part of it. Whereas when we talk about PFMA, of course, we have these three positions, and I've talked about that. And my role actually is here as well, because I maintain the finances and the human resources part of the physician company as well. A little bit about myself. I have moved from United States in 2021 with my family, and I've taken over the position after the retirement of the previous ED here. Apart from whatever I've mentioned here, I have no other connections with the town or the organization. So overall, we provide all these services: primary healthcare services, preventative programs, social services, including mental health and addiction counseling, and access to specialists like internists and psychiatrists. So before I can go on with our issue, I would like to mention some of the important stats here. So if you see here, these are alarming. So in the next 5 years, 65% of the family physicians in Ontario are considering leaving the profession or reducing their hours. In the next 5 years, almost 40% of the family physicians will be retiring. There is already a decline in the number of medicine students identifying family medicine as their first choice. And in the year 2023, almost 268 residency positions were unfilled in family medicine. And let's not forget, every day we've been seeing a greater number of patients without a family care provider. So this slide was also covered back in 2022 when I was here. So population, we have a fair amount of population, at least in these 3 towns only, not counting the other neighboring towns. And we know that the population is estimated to grow, and there will be upcoming retirements from other physicians around this area too. So of course that number or that burden is going to increase. And we are the only family health team, if you go to the next slide. So if you see that plus sign, so in that South Granville region, we're the only ones. The others are there, 2 in Brockville and 1 in Athens. So what are the issues at hand? So of course the main one is the burnout and exhaustion in the physicians. So because of these different reasons, that the administrative burden is at a record high number, the business expenses, if we expect them to run a business, that expense is at skyrocketing price. And in general, there are lack of healthcare resources and other support systems. So this is something which is all over the news. If you go to any social handle, this is one thing which is every time being displayed everywhere. So what will be the consequences if we don't pay attention at this point? We're going to create more stress on our physicians because of this uneven physician to patient ratio. And of course, keeping in mind our growing population at the same time, lack of physicians in general. So if you see the supply and the demand will be totally off. And having said that, our overhead expenses, so that is increasing anyway. And we're estimating that in the coming months, it's going to increase even higher or go even more. So in general, this whole problem is going to complicate our recruitment processes as well, to recruit another physician in this team. And eventually, what would it mean? Just losing a business or probably an employment loss for a lot of people. And at the end, our population at risk. Now, one thing that I have to mention here is, in Ontario, generally, when I said, physicians pay out of their pocket or contribute from their income to run a business, usually they're in the range of 25% to 30% of their income. We're already above 30. And as we're expecting, some of the expenses are going to go up, we're going to cross 40%. So which is alarming. Next slide, please. So what is our ask today? So here today, I'm standing not on behalf of the Prescott Family Health Team, but on behalf of the Prescott Family Medical Associates or the physician company. And our ask is that, help from the town to work with us in order to reduce our overhead costs. And of course, help with the physician recruitment process. Some of the processes were covered back in 2022 when I had presented this information in front of the Tri-Council, but now is the time to roll it. And of course, with that, maybe some other plans of hiring other healthcare members, like nurse practitioner or another PA to the team until the time we find a physician to help us. And also adding some value-based services in town to make it more attractive, a full package for the new physicians like ultrasound labs, and even blood draw labs. So that is the main purpose for our meeting today. That's it. Thank you. I'm going to have slides. So any questions?
Thank you, Dr. Matthew. I'm going to open up the floor. Any questions? Any questions from council? Lots of information, lots of good information, good references. What we usually do when you come and present a delegation is we'll sit on this now for a couple of weeks and discuss it, and we'll get back to you for sure.
Wonderful.
And one thing that I had mentioned to you, but I'll mention to council, is we will try and I'll talk to the other two mayors about getting a tri-council meeting get together, and then have you come and present pretty much the same delegation to them as well, because they're a big part of our community.
Great. All right. Thank you so much, everyone.
Thank you very much.
All right.
Thank you. I always say you're welcome to stay. Usually get a lot of bites.
We let you do the wonderful work. Thank you, everyone. Bye-bye.
Thank you. Yes, okay. Moving along, 6 is minutes of the previous council meeting. The motion reads that the council minutes dated March 4th, 2024 be accepted as presented. Can I have a mover and seconder? Councillor Campbell, Councillor McConnell, any questions on the minutes? Seeing none, I'll call the question. All in favor? Carried, thank you. 7 is communications and petitions, where there are no items this evening. 8 is consent reports. We have information package. Is there anything on that you'd like to see pulled out of the information package? Councillor Young?
Thank you, Mayor Baker. I'd like to pull out St. Charles amending residential tenancies
Okay,
and Chatham Camp, the Blue Rock.
okay.
And Could I just ask one other question about it? So with the St. Lawrence Lodge minutes,
Yes.
it refers to passing a financial report. Are those, the financial reports aren't included in the minutes that we get to see?
No, generally they're included in the agenda, but we're happy to share those if you have a question about them, by all means.
I was just thinking in terms of the ask.
Absolutely. So, yep, just send me an email and
Okay.
happy to share.
Thank you.
Thank you. Anyone else? Councillor Campbell?
I'd like to pull the Corporation of Tay Valley Township, their resolution on climate change, please.
Okay. Sounds good. Anyone else? All right. So I'm just going to read the motion that all items listed under consent reports, other than the ones that we've just taken out, be accepted as presented. All in favor? Sorry, mover and seconder. Councillor Burton, Councillor Young, all in favor? Carried, thank you. 9 is committee reports. There are no committee reports this evening. 10 is mayor. Couple of things. Last week, there was an extra joint services committee meeting where you may have seen in the news that JSC unanimously agreed to go forward with the project with Indwell for homelessness in Brockville for the whole United Counties. So that is the ball starting to get rolling there towards a big project with 150 beds is the final phase, right? A lot of T's to be crossed, a lot of I's to be dotted. The biggest concern, I think, by a lot of the councils that were there is government funding. We need to have government funding on this. We can't get stuck with the bill, that being counties and joint services. So we're going to move forward as long as we're going to get provincial funding. Correct. Right. There's a food bank drive this weekend at Giant Tiger and Independent, You're Independent for the fire department. I didn't get any numbers. Did you get any numbers on that, on how well they did?
That's,
The Saturday, was this the
oh,
Saturday?
no, I didn't.
Okay. Big figure skating show last week. It's nice to see our rink getting used. I love hearing the fact that there's not enough parking, but I digress because it's nice to see it full and to have that problem up there is great. I also attended, along with Mayor Shaver, the Wellington School had an art show that was on the news, I think. And the class, I think grade 4 or 5, they did 5 or 6 murals of Black influencers. And it was really well done. And they made them out of Lego. So if you ever get a chance, you can probably Google it as an article. But they did a really nice job. And the kids were so proud of themselves and they spoke so well. Even one child was covering for someone who was sick that day. And he didn't even read his papers. He just read on like it was like he had wrote the thing. So they did a really nice job and it was really nice to see. And lots of, Lisa Swan was there too. So it was a good turnout for that. So it was really nice. That's all I have. So I'm going to go around the tables. Councillor McConnell, do you have any?
Thank you, Mayor Shankar. I haven't had any committee meetings since our last council meeting. I did attend the fundraiser for Shakespeare on the same weekend as the skating show. I'll let our board representative speak to that, but it was quite an enjoyable evening. As you know, I'm a representative on the cemetery board, so I took a walk through the cemetery since things have pretty much melted out now. Not too much winter damage, a few limbs off the pine trees that are the ones that are very susceptible to breakage, same type as on the golf course that they have to deal with every year, but nothing extensive. We did have planned with the town to have some limbs and some trees addressed last fall. That obviously wasn't done, but then again, I think we just ran out of time because I see the same outfit out trimming trees now. However, the gravel road and the yards are way too soft in there to address that right now. So we're gonna have to let that go till either the summer or perhaps even next fall again. There was a couple of tombstones, a more modern type of tombstones that have been upset, but I don't think it's malicious damage. I think it's more heaving frost work. So I'm going to be recommending that we get those two fixed. And we have the local company that can do that. Other than that, we're just waiting for the weather to warm up a little bit, get a little less damp, and we'll start to clean up and go from there. Thank you.
As you say that, it's still snowing out.
I know. Yeah.
Thank you. Councillor Young?
Thank you, Ms. Shaker. March the 5th, I attended the Affordable Housing Information Night at the Maitland Fire Hall. It was really well done. Sean Merriman from Town of Prescott was on the panel. They discussed zoning requirements and soft costs that you could like drawings, bylaw requirements, a whole bunch of information about that. And then the counties discussed the funding streams for small landlord and secondary suite. So it was really well done. I think there's going to be a third one down in Edwardsburg. So if you're interested, keep an eye out for that. March 12th, I attended the Walker House monthly meeting. Lots of positive energy, great programming, and just a lot of enthusiasm. So it's really good to see. And just some upcoming events. The Leo Boyven Showcase, March 28th to the 31st. Leeds and Gravel Small Business and Trade Show will run March 21st to the 23rd. Little Barcelona is now open for dine-in. My Main Street funding is available for individual businesses up to $20,000. And Water Girl Quilt, one favorite local quilt shop in Canada.
Wow.
Yeah, and that's all for me.
Thank you, Mayor Shaker. Yes, there was, we called it the Kinder Spirits high-end cocktail party at Renegades through Shakespeare. It was well attended, lots of beautiful hors d'oeuvres, some nice cocktails. We had a live auction. We ended up raising over $1,500 that night. It was really well attended at a library meeting. And our new motto is, we're more than just books. So we have lots going on at the library. There's puzzles and there's painting, and they did a March break craft for kids that could go in and grab their little craft and take it home. We have a Dungeon and Dragons club there. So lots going on there. So our library is definitely more than just books.
That rolls on.
Right? Yes.
Thank you, Councillor Britton. Councillor Campbell?
Thank you, Mayor Schenker. I attended the fire admin meeting on March 5th, and they're really out in the community this month. You mentioned the food drive. The early years program visited the fire hall on March 12th. They're going to be having a booth at the trade show at the Leo Boyven that Tracy mentioned the dates, 21st to 24th. And they attended the emergency services at the ACCC March 11th. So yeah, they're, besides fighting fires and helping on our highways, they're out there in the community really doing their stuff. So
Good.
great. Oh,
Yep.
One more thing to add. Completely separate, I attended a excellent concert at St. Andrews on Saturday. It was this put on by Showtime South Grenville in partnership with St. Andrews, and it was the Emerald Isle to Broadway. We had Chris Coyu and Alex Florio in the singing with drummer and pianist. But you walk in and there's all these tables set up with St. Patty's Day stuff and green napkins. Anyway, they had baked all these goodies, squares and cookies, and people were coming around with coffee and tea. So, and the concert was awesome. So I just want to tell Prescott that we have just a wealth of arts in this community.
Lots of talent. Great, thank you. That's awesome. All right, we're getting to the section on staff reports. So we have 5 staff reports tonight. First one will be the strategic plan adoption. Staff report 20-2024, the 2024-2027 strategic plan adoption. Report is from CEO Matthew Armstrong. Recommendation reads that the council adopt the 24-27 strategic plan. Can I have a mover and seconder for discussion? Councillor Young, Councillor Burton, Mr. Armstrong, the floor is yours.
Thank you very much, Mr. Mayor. So this is a culmination of several months worth of work, dating back to last October when we met as a group to a one-day guided session. From there, kind of taking what we came out of that one-day session, putting it into words, reviewing the content that was tabled in December to council, as well as a guided meeting on January 8th. From there, we opened a public comment and feedback session, which we reviewed at the last meeting of council. And then we have before us the strategic plan today. So really the only change from a contents perspective is the formatting as well as the inclusion of pictures. And I think the pictures really help to tell the story of not only where we've been, but what we're trying to achieve and some of the things that we have a foundation to build on. More than happy to answer any questions there might be, but as it stands, thank you.
Thank you, Mr. Armstrong. Any questions for Mr. Armstrong? Councillor Burton?
Just a comment, and I totally agree with Mr. Armstrong. The pictures, really add the effect of the things that we're doing and where we've been and where we're headed. That's perfect.
Thank you. Councillor Campbell?
Thank you. I'm looking forward to more of the action plan items through the operational and project budgets to really flesh out what we're going to be doing with the plan.
Okay.
If I can just speak to that, is there something in the strategies that, beyond the strategies that you're looking for?
No, I think it's well framed. I guess I'm looking for more details on the kind of projects we'll be doing. Thank you.
Anyone else? Councillor McConnell?
Well, as you know, I was not a great fan of how this was done, but I'm not going to belabor that. My main comment here is not so much on the strategic plan itself, but it's the willingness of council to buy into the plan and actually include it when they're making votes. If you're voting on something, see what the plan says, and if you believe in the plan, vote accordingly, not because of some other issue that you have. Thank you.
Thank you. Councillor Young, anything?
No, I thought it was really well done. Looks great.
Yeah. Thank you. All right, I'm going to call the question. All in favor? Carried, thank you. All right, 12.2 is staff report 21-2024, the community grant recommendations, intake number 1. This report is also from our CEO treasurer, Matthew Armstrong. Recommendation reads that council approves of the 2024 community grant allocation recommendation number 1, totaling $45,250 in financial support and the in-kind request as outlined in staff report 21-2024. Can I have a mover and seconder? Councillor Young, Councillor Campbell. Matthew, the floor is yours.
Thank you very much, Mr. Mayor. So what you have before you is kind of a summary of all of the applications that were received. The working group met last week on March 12th to review all of the applications and develop the recommendations. So when we go to the financial recommendations, you can see, for the most part, was approve what was asked for. There was a reallocation between South Grenville Minor Hockey and Prescott Figure Skating, making them like-sized in terms of the grant amount. Cycling Without Age, continuing South Grenville District High School, doing the same caveat as last year where we would match what Edwardsburg, Cardwell and Augusta provide. And then some of the newer applications, two of them didn't qualify under the current program, being Prescott Figure Skating Club, as well as St. Lawrence Academy. And then taking a look at the Friends of St. John, reducing it from 7,000 to 1,000 to provide some initial funding.
Matthew, I think you said figure skating. I think you
Sorry.
meant curling.
Yeah, sorry, Prescott Curling Club and the St. Lawrence Academy, both of which didn't weren't eligible in the program due to the nature of the expenses. And then the Seaway Optimist Club is looking to create a junior optimist club as well as a fundraiser. So instead of supporting their request for $5,000, it was recommended that we support the in-kind requests that they had. So moving to table number 2, went through each of the in-kind requests. All of them were approved. We added 2 columns this year, one for foregone revenue and another one for additional costs. The additional costs are in relation to anyone that we have to have in from staff from a operations perspective. And that would be an overtime because most of them are on nights or weekends. And then the foregone revenue, neither the foregone revenue or the additional costs will have an effect on the budget because we didn't include the additional revenue in the budget. And therefore, we're not losing anything. And we always include an overall overtime amount for our operations group. And these wouldn't cause an excess in those areas. So more than happy to answer any specific questions, but did provide kind of a more in-depth discussion on each of the applications if the full amount wasn't approved.
Thank you. Questions for Mr. Armstrong? Councillor Young?
Thank you, Mayor Shankar. It's not really a question, but I just have a comment about the Upper Canada Folk Fest Festival. So I was appointed to their committee as a council member. What it is an 8-hour long musical festival, one day in August. I just wanted to point out one thing with the strategic plan that we just passed, how it fits in with that. It facilitates a thriving downtown, mobilizes youth, gives them a collaboration and opportunity for success. And that comes from the Friday night. They have a Friday night Rising Stars performances, and there was no fee or ticket price to get in, and it was really well attended. It also would help increase tourism and it maximizes waterfront use. So I just wanted to just go over that. They were the only repeat applicant to receive 50% of their ask. And actually they asked for 10,000. So they received 37.5%. But going back to last year, they only received 50% of their ask, and they're the only applicant to do so. I just, with us trying to say that, you know, the town can't do everything, we really want to support the volunteers. It's an event run entirely by volunteers. It's their 5th year in existence. The first 2 years were COVID, and the 3 and 4, last year the weather was awful. The 3rd year would be a rebound. And I think a lot of festivals are just coming into their own this year. So I was just wanting to say that I would support possibly increasing the 3750. And thank you.
Thank you. Who's on that committee? So just to start, are you on that committee?
No.
No, okay. Councillor Campbell, Councillor Kirkby, and Councillor Hawken. Okay. They can't answer. All right, Councillor Burton.
Thank you. I just wanted to comment on, I think it's important the way that Mr. Armstrong laid this out this year. I mean, it's important to make sure that people that are applying for the grant is also aware that, you know, it takes time, you know, staff time and money, and, you know, sometimes the asks are bigger, but they don't realize that we're calling in staff for overtime, and it might just not be one staff, it might be 2 staff, you know. So I think it's important that organizations, once they see this and say, you know, I only got a certain amount of money, but I see the difference because it's all laid out here, all in black and white. So I think that's an important information that people can see this right up front. Thank you.
Thank you. Anyone else? So Counselor Young, did you, so part of this needs to be approved by all of council.
Mhm.
So do you want to re-vote on this, or how would you like to proceed? I know you'd like to give more, but you know, the same could be said for minor hockey, asked for 10 and they only got 5, right? This year.
Yep, through you, Mayor Shankar. I think mine was because they were a repeat and they'd had 7,500 the last 2 years, and then this year only got 50% of what they had, so nothing to do with the ask. The ask is one thing, but then the repeat. I was just hoping that maybe.
I know there'll be another intake. When's the next intake?
Next intake will open May 15th, close June 15th. And we hope to have it back in front of council on the August meeting, but if we can get things moving, then we'll do it for the July meeting.
Would that be too late?
It might be, but not for, the only reason is that they said that they use those funds to pay for performers to come.
So this is their 5th year?
Yeah.
And I mean, I'm a big fan of theirs, but I think last year they only had 40 people buying tickets.
They sold 80 tickets, but only 40 approximately because of the weather. Yeah.
Right.
Yeah.
So that's hard for us to give $10,000 to.
Oh, I'm not looking for the 10,000. No. No.
This could be their make or break year for them, right? Councilor McConnell?
Thank you, Mayor Shankar. I've sat in this committee many times, and as have you, I think last term, I think we were on it together last term. There's always a lot of give and take. But at the end of the day, 3 people of council, which is a reasonable proportion, decide on these figures, and they usually have pretty good reasons for doing it. They balance one against another in a lot of things, and I'm not inclined to second guess their reasons. I would go with what we have here.
Yeah. I mean, I agree with you, Councilor McConnell. That's why I was just looking for other avenues, like maybe the second intake or something like that. Right? Because there's going to be a few people that are going to be not too pleased with this, but you know, we have to make a decision somewhat. I'd love to give everyone everything they ask for, right? I mean, even just our delegation today, they're looking for money, but we don't have Donald Duck's little golden thing isn't back there. All right. In that case, I'll just call the question. All in favor? Carried. Thank you. All right, the next report is report 22-2024, the 2023 Prescott Drinking Water System and Wastewater System Annual Reports. This report will be from Mr. Matthew Armstrong.
Thank you.
Recommendation reads, I'll just read the recommendation. The council accepts the 2023 Prescott Drinking Water System and Wastewater System Annual Reports. Mover and a seconder, please. Councilor Campbell and Councilor Young, thank you. There you go, Mr. Armstrong.
Thank you very much, Mr. Mayor. So if you remember back to your training on water and wastewater, one of the whole concepts is around a multi-barrier approach, so that there's multiple layers, people understanding, people reporting, going to the authorities such as council to make sure that we're following what we need to follow. And so this is part of that barrier approach. where we present the annual reports to council, highlighting any adverse issues as well as the overall performance of the system, both from a water and wastewater perspective. So there's, I highlighted some of the areas in the report in terms of any compliance or non-compliance issues, but more than happy to answer any questions there might be.
Thank you, Mr. Armstrong. Any questions for Mr. Armstrong? Well, all right, I'll kind of call the question. All in favor? Carried, thank you. All right. Next up is staff report 23-2024, Digital Main Street Coordinator Contract Extension. This report will be from our Economic Development Officer, Dana Valentine. I'll read the recommendation that council approves the contract extension of the Digital Main Street Coordinator position, allocating up to 50% in wages for a period of 3 months beginning April 1st, 2024, in partnership with the Township of Edwardsburg Cardinal, if subsequently approved. Mover and seconder for discussion. Councillor Burton, Councillor McConnell, Ms. Valentine, the floor is yours.
Thank you, Mayor Schenker. Through to council. So I'm sure you're all, excuse me, familiar with our Digital Main Street program. That program has been funded by the province of Ontario through the Ontario Business Improvement Association has been the main partner, delivery partner for that program. And we've seen, gone through several rounds of funding, and it's been a very successful program to date in our community. Since 2020, the program has provided significant support. Unfortunately, the province has decided not to renew the program effective March 31st. So that would bring the contract for our current Digital Main Street Coordinator to an end. The partner townships in this program are Edwardsburg Cardinal and the Township of Augusta. Edwardsburg Cardinal has seen a lot of positive results from the program as well and expressed early interest in looking to find ways to continue to support this program. So we had some initial discussions with them and have also reached out to Augusta. We're just waiting for a formal response from Augusta Township on this. But we've received some initial support through Edwardsburg Cardinal. They'll be taking a recommendation to their council to provide 50% of funding for the coordinator position for the next 3 months. That will go to council on the 25th. It has been endorsed at the committee of the whole, which does include a majority of council. So I would hope that, in all likelihood, it would be approved. So we wanted to bring this recommendation before council. The position essentially would allow for a lot of the aspects of that program to continue to be implemented. The direct one-on-one business counseling has been a significant part of that program. The business funding has been a very minor piece, to be quite frank. It's all of the other supports that the coordinator has been able to provide to businesses that has really had the most impact. So that's what we're looking to do, is to continue on with a bit of a hybrid model of that program. And as you'll see, I did include some numbers here. Just in this current round, the program has assisted 85 businesses in Prescott, 129 in South Grenville, which includes the townships of Edwardsburg Cardinal and Augusta. And a total of 59 digital transformation grants have been distributed, including to 42 local Prescott businesses. That represents a direct investment of 100,000 into our community and nearing 150 into South Grenville. And as you'll see here, another important piece to this that I just spoke of is the 143 business visits and 86.5 hours of one-on-one business consulting that's been provided through this program. That's been a very significant piece that our businesses would greatly miss if it disappeared effective March 31st. So council has also passed a resolution in hopes that they can advocate the government to rethink the termination of the program and hopefully refund it. I think it is getting support from some other municipalities. I know it's certainly getting support from Edwardsburg Cardinal. It's been circulated to the Office of the Premier and the MPP. So there is that hope that within this next 3 months, a change could possibly happen. And that's the other purpose of this request, is to hopefully buy some time, not only to maybe see a change, but to also provide us with some time to pursue other funding opportunities that might provide new programming for a hybrid model of this position to move forward. So the total cost to the town for this position would be $49.50. That's the 50% allocation. The total wage cost would be $9,900 for the 3 months. And this would take the coordinator from April 1st to June 30th. And that's it. Thank you.
Thank you, Ms. Valentine. I'll open up for questions, but I do have one question. What if Augusta wants to come on board?
Then at that point, it would reduce to a 33, 33, 33.
Okay. Councillor Burton?
I love that our neighboring municipality wants to be a part of this. And I think it's important, you know, they're seeing the success that we're doing and they want in on it. And that's great. And I'm hoping that the government comes and helps us continue with this program. It's important. Thank you.
No problem. Councillor McConnell?
Well, when I was in small business, I would have killed for something like this, quite frankly. There was no assistance of that ilk available. So I've been a supporter of this from day one, but it is a provincial initiative. And I'm certainly going to support the 3 months, but I'm not in favor of adding another municipal employee at the end of that 3 months if the financing is not there.
Thank you. Anyone else? Councillor Campbell?
Through you, Mayor Shankar. So you've mentioned, Dana, that the program assisted 85 businesses in Prescott. And how long is the person doing that? Like a year or?
So this current position was a year. The total funding period for this program was 3 years.
So how many more businesses do you think this person would be able to accomplish in the next 3 months?
That would be a hard number for me to say accurately, but I can tell you that on a regular basis, they're probably consulting anywhere from 4 to 8 businesses on a weekly basis, or receiving new intakes, probably 2 to 3 new businesses coming in on a weekly basis looking for support. So it's something that is definitely ongoing.
I guess we don't know how many businesses there are in Prescott, do you?
Off the top, well, there's for eligible through this program.
In our town.
That would open it up to all businesses, yes. So we're nearing 200 businesses in Prescott.
Okay. I agree with Councillor McConnell about 3 months, but not continuing past that.
Councillor Young?
Thank you, Mayor Shankar. Lots of testimonials of people that have used it, but the one thing that differs this is that if the new position goes ahead, it won't have the same restrictions that the actual digital Main Street program had. So therefore, that could open up the door to assistance in other ways that might not have been covered.
Absolutely, yeah.
And there's a lot of businesses as well, even people that I talk to that would like even more assistance. So they may have already tapped into the grant that was available, but now with the restrictions lifted, they may be able to pursue even more.
And thank you for that, Councillor Young. That's been one of the biggest limiting factors of the program, the way Digital Main Street was structured. The coordinator could only take a business so far. When it came to doing more of that hands-on, one-on-one assistance, it really had to be kind of passed over to the business, because the purpose of the program is to enable business owners to be able to do these things on their own. But a lot of times, just a little bit of extra assistance and hands-on support would get them over that edge and give them that, you know, that comfort level and familiarity they need to then make those programs work, maximize the benefits of the program. So it would definitely open that up, and we would see a lot of existing businesses that had taken advantage of the program come back through as well.
Dana, a question for you. If the province is removing, obviously, the funding, you know, like there was 2 or 3 batches of funding, right? So they're not doing that anymore. Is this next 3 months just to kind of clean up everything that's been done or are we gonna start looking for, possible different funding methods to keep that position viable?
That would really be our primary focus over the next 3 months for the coordinator themselves. Their focus would be continuing to provide business supports and really onboarding a lot of new businesses. The program needs to be wrapped up by March 31st and final reporting submitted within about a week of that. So it wouldn't necessarily be a wrap-up period, but it would be an opportunity to take, I think, some of those existing files, work that's being done with those businesses and be able to take it to the next level for them, as well as bring on some new businesses and allow us time as the support administrative staff to pursue other funding sources and potentially have some discussions about partnerships and maybe a hybrid, even part-time casual contract position that could be developed, established at some point in partnership with the original partners who were in support of the program. Again, it's time to allow these discussions to take place. But by no means would we be recommending that this become a full-time employment position at the end of the 3-month funding period. That's certainly not what we're angling for here.
And I mean, there's a new program right now, the CDAP. Is that affected at all?
It won't provide funding for this type of program. My Main Street, there is a portion of that, a community activator piece that could potentially provide funding for wages, but it's very project specific. But we really haven't taken a lot of time to start researching what other options might be out there. And this would allow for that time.
Thank you. Any other questions? All right, I'm gonna call the question. All in favor? Carried, thank you. Back to back, Dana. Item staff 424-2024 is my Main Street funding program application. So this report will be from Ms. Dana Valentine as well. The recommendation reads that council directs staff to proceed with an application to the My Main Street Community Activator Program for funding support in the amount of $149,500 for the purpose of completing community enhancements within Prescott's Riverwalk District to support ongoing placemaking, business development, and visitor attraction strategies. Can I have a mover and seconder, please? Councillor Young, Councillor Burton. Ms. Valentine, the floor is yours.
Thank you, Mayor Shankar, through you to council. As I just alluded to, there is a new funding program. Well, not new, actually. We had actually unsuccessfully applied to this program a couple years ago, and we were able to tap into funding through a different program, thankfully, for some recent improvements. This has been re-announced again, and applications are due March 31st. There's 2 streams to this program, the My Main Street Community Activator and the business stream. So the business stream is the one that Councillor Young mentioned at the intro of council that can provide up to $20,000 for businesses. This program is geared towards communities looking to engage in placemaking activities primarily and can provide up to $250,000 to support those projects. Funding is available up to 100% of total project costs. Based on what we've seen in the past, the most successful applicants do tend to be those ones that leverage the funding with their own contribution. So that would be what we'd recommend if council deems fit to pursue this funding. So this would provide, essentially, I'll take you through the list of projects that we would like to apply for. Number 1 is an interactive mural designed to replace the existing concrete barrier that blocks the former King Street entrance to the Clock Tower parking lot. So this is a project, approximate cost would be $5,000. This is a project that had already essentially been tabled for this year's budget. It's something that needs to be addressed. So the goal is here to provide some third-party funding to offset the municipal cost for this project. And I just prepared a very, very preliminary concept to give council a sense of what this space could look like. Beautified, bringing some plantings in here, possibly having an interactive mural. It would be double-sided, so we could have different designs on each side. And it would really, the visibility is fantastic for this location. I think it would be a great complement to the streetscape. And the second project would be completing the design, landscaping, and beautification of the Coast Guard planting beds and the retaining wall that runs along King Street from George to St. Lawrence Streets. This has been a project that was identified as a potential 2024 project. It's certainly, I think, something everyone has expressed an interest in addressing. The Coast Guard has expressed initial interest in looking at a partnership. Of course, as a government entity, they certainly lack funding when it comes to these type of projects. And we're anticipating that this could be the perfect fund to offset the cost that would have to go into this. Really envisioning this would be a community project, partnering with the Horticultural Society and some other groups to really get some ownership and pride in place happening here, and also partnering with the Coast Guard, whether, if it not be funding, there could be some in-kind supports that we would hope that they would provide. So again, the goal here is to provide or secure third-party funding to offset the municipal cost for a project that is kind of already on the books. And thirdly, council has previously approved $15,000 for a new directional signage program. This program would be available not only for attractions, as you see in the mock-up here, but for businesses as well. So we envision businesses paying a very nominal fee to be part of this directional sign program and have some visual signage for people coming into the community to direct them to their place of business. So the initial cost amount allocated by council for this project, which is already in reserves, is $15,000, and we would be applying for an additional $15,000 through the program to cover the full cost of the installation of the new signs and poles. It is a pretty extensive project, depending on the number of poles that we want to install throughout the community. And then the next one is we've received a request from multiple restaurants, a couple that have opened recently, Wing House and Renegades, that are very interested in opening up a patio space outside of their restaurants. They'd like to provide patio service for their patrons, very similar to the patio that you see at Chuck's. Unfortunately, the location of these businesses doesn't allow for them to construct something on their private property. So they've approached the municipality to see if there would be support from the town in allowing them to use a portion of the sidewalk space for their patios. This is something that I'm sure many of you've seen done in other communities. Brockville would be the next closest example I could give you. But pretty much every small town and large city throughout Canada is engaging in these patios and trying to provide supports for businesses. So we're recommending that very same thing. There would be a cost to purchase the barriers. We're just looking into costing right now. We're obtaining some quotes from a couple different companies. One from something that would be more of a ornate metal fence, again, kind of similar to what you see in Brockville, to something a little bit more cost effective. Again, the availability of funding, I think, will really dictate the type of barrier that we're able to go for. So we wanted to apply for the dream. And if we don't receive the full funding, then we would reduce that to something a little bit more cost effective. And there would also be a fee for businesses to be able to have this real estate outside of their property. There will be a bylaw required that council would have to pass that we'll be bringing forward for consideration in coming weeks. Initial estimated cost for this, because we're only looking at 2 restaurants at this point, is $5,000 for the barrier fencing. And we would propose applying to the funding to offset the municipal cost for this. Not a huge cost, but it would have a huge impact in the downtown. And sorry.
Those barriers, are they permanent?
No, see, so they're portable. They can come in and out. They could go in any location. They come in sections. So they would be like essentially 3-foot sections, so they could face in front of these restaurants. If, say, another restaurant wanted to come on board and this restaurant come off, they could easily be relocated to another area. And we would propose, ideally, if council should see fit to approve this year, we would anticipate some additional businesses probably coming online with that request next year. And ideally look at purchasing some additional barriers down the road.
Thank you.
The next project that we would like to pursue through this funding is a number of upgrades to the Prescott Promenade and pop-up sites, all of which have been already noted in this year's budget request. So it would essentially offset the municipal cost for this project if approved. So there's an example of just a few items that we would like to add, being additional seating, upgraded barrier, portable power, signage, branded umbrellas and planters. A few of these items are outside of what would be hopefully approved through the municipal budget. And that's why we're requesting some additional funding, but it would also offset the municipal costs that would need to be allocated.
Dina, what's the upgraded barrier?
Very similar. We'd like to do similar barrier to what it would be going in front of the restaurants, and also bring some street trees in with that, because we're doing some nice street trees and planters this year. So we'd like to bring some new street trees in, and then an upgraded barrier with a new decal to really elevate the look. It just doesn't, the Jersey barrier works, but with the banner on there right now, it's very obvious what it is. And it doesn't necessarily provide for the visual aesthetic that we've always been going for. So this would provide some additional funding to really improve the aesthetic of that gateway.
Right, that's the where the market was?
Exactly, yeah.
Gotcha.
Then you can see it as you're coming down the Edward Street Bridge. So it would be a nice wood barrier, hopefully, depending on the funding. If we can get the funding, ideally it would be the metal. But we're looking at, so for the interior, you'll see there's two fences here. The exterior would be the very nice metal barriers. And then the interior would be something a little bit more cost effective, like a 4x4 wooden fence, similar to the beautiful one that was constructed for the south end of the promenade that has the rope in between the fence posts. So aesthetically pleasing, but it wouldn't need to provide any sort of actual structural support. So that's why we would go with that on the interior of the patio.
Thank you.
And then we would like to purchase 9 new black traffic posts to replace the existing traffic light poles along King Street. Research was done, and the cost of repainting these posts is extensive. It is actually cheaper in the long run to just purchase new poles. So the cost for this is $72,000. We'd be looking at 3 poles at King and George, 2 at King and Center, and 4 at King and Edward. And that would be a fully grant funded element. And then this is another idea that's come up in several conversations suggested. I've heard this from visitors, from municipal staff and the like. It's members of council, current and former, have often suggested a treatment at the deep water dock where the vehicles tend to park and have an outlook over the river immediately west of the scuba dive park. So what's been suggested for this area would be the construction of a patio that looks very similar to the street patios that you see on King Street, the 2 street patios that were purchased last year. It would be very similar in nature to this, and have some seating, probably a combination of tables and Adirondack chairs, and provide people with just a nice place to rest, get out of your vehicle, enjoy your lunch alongside the river, take in the shipping traffic, and grab a selfie or two, whatever suits your fancy. So it's kind of a weird dead zone right now, and it's a bit of a safety issue for the municipality because we have a lot of vehicles that drive up into that area, either pull up very close to the barrier, which is a very low wood barrier, and just a lot of people that get out of their vehicles, walk along the waterfront there, and if you're not paying attention, you can very easily catch your footing on that barrier and end up in the water. And we certainly want to avoid that from happening, especially as we see this area get more and more activated with some of the scuba park improvements that have been put in there and the port of call, the additional traffic that we're getting there. I think it would certainly be warranted and provide, again, things like the cruise ships that we have coming in with a great place for some of their passengers to find their sea legs and take in the views on the patio. So this would be about $10,000 and it would be solely funded by the grant if approved.
I was looking at this earlier. There was a question came up from Councillor Kirkby, and one of the answers that Matthew provided was, Matthew, you said that we don't want cars parking there because it's starting to disintegrate.
Yeah, so when cars are parked right against the brake wall, we know that it's washing out underneath. The weight of the cars are causing a problem being so close to the brake wall. So we want to move them back away from that. This year, we're also going to be paving that area. It's been on the books for a couple of years and we'll proceed with this year. And then once it's paved, putting this possible patio will then also provide a little bit of separation from that brake wall as well. And one of the things we would want to modify to the patio is that the railings would be see-through, as opposed to the kind of solid railings that we have on the street patios on King Street, is that we still want people to be able to see through and enjoy the river.
Thank you.
And then just finally, I've noted that we'll be pursuing support from partners, including CF Grenville, the South Grenville Chamber of Commerce, and the Prescott BIA, because it is extremely important to demonstrate partners for the purposes of these funding applications. So the total project value is estimated at $227,000, $149,500 of which would be requested from My Main Street, bringing the municipal contribution to $77,500. As I noted, council has previously allocated $15,000 in funding towards the wayfinding and included a lot of the other elements such as the parking lot barrier, pop-ups, promenade improvements, and the Coast Guard improvements in the draft projects budget. So if successful, this would ideally offset the required municipal contribution towards these projects. Thank you.
Thank you. Good report. Questions for Ms. Valentine? Ms. Burton?
Thank you. Dana, the interactive mural, are you gonna have something that says like, you are here? So people can, if I'm new to town, I can say, okay, where am I? And then it will point people into the right direction.
Yeah, so
You're thinking?
if you'll see here, the interactive portion would be more of the middle piece, and then we would have it flanked by the map, our new Explore Prescott map. And that would have the indicators, you are here, and then with a bit more directional guidance for exploring some of the surrounding areas.
Oh, excellent.
And we would like to, as something I didn't mention as part of the directional signage, we would like to incorporate some fun sidewalk decals as part of that. They would be a permanent decal, so they would last when it comes to snow plowing. There wouldn't be any issues there. There would be they're non-slip as well. So they would actually provide a complement to the directional signage. And as you're on the sidewalk, you would come across one of these decals every once in a while and, Fort Wellington, 500 steps that way, something to that effect, or more shops here, or beach this way, haven't actually come up with the text for these things, but I think that'll give you an indication of what we're hoping to do. So you would have something, that area would be well concentrated with some of those suggestive decals to kind of lead people along a path from that destination.
I love that idea.
Me too. That's so much better than the concrete barrier. Any other questions for Ms. Valentine?
Sorry, through you, Shankar. Was there any indication why you didn't get the grant approved the last time from the grantor?
I think it was just simply a matter of it being oversubscribed. It wasn't that the project itself wasn't viable. We had looked for funding for pop-ups, street patios we'd applied for as part of that one. We ended up receiving that funding through the Canada Community Revitalization Fund, another grant that just happened to come out right around the same time. But it was very much just a matter of it being oversubscribed, and definitely encourage us to continue to reapply to subsequent rounds.
Okay, and what I read, it didn't really indicate any preference for people coming in with matching funding or their own funding. I'm just feeling that's a lot of money, 77,500. Yes, sir.
It certainly is, yeah.
So the 77,500 is already, the 15,000 for wayfinding was approved in previous year. And then the remaining amount were all part of the draft project list that has already gone through council.
It was essentially money that council would be spending anyways, and this fund, if received, would offset that cost and save the town money in the long run.
Matthew, did we approve that draft?
There was no comments for it to be changed. So it was to come back for final approval when we approved the budget.
Okay.
We have certainly noted that it is pending the approval of those priority projects as per the 2024 budget recommendation. So very much it's a timing thing. We only have so many weeks to get this application in, and it may not align with council budget approval. And if the funding is approved, this doesn't mean that council is committing themselves to this whatsoever. You're just endorsing the application at this point. If approved, if God forbid, council chose not to make those allocations to those projects, then we would request an adjustment of the funding through the provider.
So I read that the work needs to be completed by December 31st of this year. But if you had started anything last December, you could put in receipts. And have any of these projects, have you spent any money on any of these?
Not these, no.
And do you feel that with all this, you can get it done in 7 months?
Absolutely, yeah. These are projects that were all on the books anyways for 2024.
Right, and what's that? So my, just thoughts about, the seating down by the river. And you can prove me or tell me if I'm wrong, but I didn't see a lot of use of our sidewalk patios last year. And I wondered if we could just move those down there rather than buying new ones.
So those sidewalk patios, and we did provide, we can provide some additional data in that we have some environics data that will give council a really good indication of what some of the use of those patios were. And we also had the results of the surveys that were quite positive as far as people providing personal accounts of their use, a large majority of the population. And a lot of great insights from the business community. In fact, I just had a great conversation. I'm gonna go off on a little tangent here, but sorry, you opened the door. I had a great conversation with Catherine Beer, owner of the Craft Boutique downtown Prescott. And it was just a few weeks ago, and she actually, sorry, I apologize. It was Justin, our business development coordinator, that had the conversation and related it back to me. And she made a point of saying how positive the addition of the patios was to the downtown last year, and that she was one of the biggest skeptics at first when they came in. She was concerned. It was, the loss of a parking space to, potentially deterring her customers. And she said it was the exact opposite impact. She said, I've never had so much foot traffic in my store. She said at the beginning, the first month or 6 weeks, the patios were a little slow, but she said by the end of the summer, there was not a day that went by that she couldn't look out her window and see people on the patio on multiple occasions throughout the day. And it was located right in front of her business. So I think she would provide a great testimonial to that use. And, the visual being the Museum and Visitor Center being located right across from the Clock Tower patio and very in close proximity to the one down by the Fish and Chip place. just the usage that we witnessed, was very consistent. And like I say, I'd be happy to provide council with some of those environics reporting, which we will be anyways, but it was really, encouraging to see. And we would certainly look at other locations to, move things around and make sure that we're not, putting them in the exact same place every year to again, try and get more usage out of them. But those patios aren't suited, they are specifically designed to be a street patio, and that's frankly why they are so expensive. They're engineered, they have a metal base that is engineered to raise and lower to be in line with the sidewalk. That's the real purpose of those. That's their intent. Totally different than a waterfront patio, which could be easily constructed out of wood for probably a third of the cost.
With the riverfront patios, is there any conflicts with the St. Lawrence Cruise Lines docking?
No, it would be east of that location, well out of the way of the protocol.
Don't tie up there.
No, no.
And just the sidewalk restaurant patios, is that going to decrease the parking spaces right in front of?
No, it will have no impact on parking. The patios will be contained to the sidewalk as well as the sidewalk. So we would just reroute the sidewalk to the southern portion. It would still be a 4-foot sidewalk, so ample room for anyone with accessibility issues to navigate. We're blessed in the fact that our sidewalks are quite wide.
They're uneven though in some places, that's my worry.
They are, and
Take a path down to make sure I'm not.
and that is the purpose of having that outer barrier as well, having the barrier between the edge of the sidewalk and the parking spaces. So that if, God forbid, due to the slope, someone should trip or fall south, then they would have that barrier to hold on to. And any sort of issues such as potholes or grading issues would be dealt with by operations as part of the installation of the patio barriers.
Looks like a great program.
In a wing house for the patio, would that just be on King Street?
On King, they did request George. They'd expressed interest in George. Unfortunately, the sidewalk is quite narrow on George, so we would have to decommission some parking spaces to accommodate that. So what we're proposing instead is actually providing them with frontage in front of the currently abandoned commercial space that has been unoccupied for many years and likely will be for some time due to some legal right-of-way issues that are still need to be resolved. It's the small, I think it used to be I can't remember what it used to be. It's the blue and white awning with a metal grate.
Prescott?
It's an eyesore. It's a,
The Everyman Smoke Shop for many, many years, Jim Pilios.
And then the Plate Star was renting movies in there? Yeah. Okay.
and it's just an eyesore. And this patio would provide a nice block for that until that property should be occupied. And if it should be, then at that point, the patio would be reduced.
Great, thank you. I was wondering about that.
And I totally encourage tree planting and planters.
Oh,
Okay, thank you.
Any other questions for Ms. Ballard, Ms. Young?
Thank you, Mayor Shankar. Dina, in your experience, if we receive partial funding, because there's not a whole lot of money available, it doesn't look like, but would they be project specific or could we use that partial amount where we wanted to use it?
I think that could be negotiated. At that point, we would probably prioritize where we felt we would get the most bang for our buck. And then you could go back to the funding partner and renegotiate the terms.
Okay, thank you.
Any other questions? Councilor McConnell?
Not a question, Mayor Shankar, but some comments. I'm not going to support this because quite frankly, there's several things in here that I'm not in favor of. The waterfront patio, that's one of the windiest places on the riverfront. I walk there all the time. It's also a place where people fish all the time. And it's also a place where people do not pull right up to the water. The walking track around there is to come off the sidewalk south of the little building that we put there for changing and to walk on a 90-degree angle towards the sidewalk that extends into Riverwalk Park. It doesn't go around that way. I think that'd be a poor place for tables. I don't believe that we should be forking out money for Main Street patios. Businesses should be doing that themselves, both the two restaurants down the street that have patios now, that's what they've done. I think if you want a patio, I have no problem whatsoever providing them the space on the main street at no cost. But I don't believe we should be kicking in for the construction of same. The planters in front of the Coast Guard, yeah, they're an eyesore. They were planted, they were really nice back in the 80s, but they've never been looked after. As they decreased the population at the base, the person that looked after their shrubbery and stuff was no longer there and they were let go. And yeah, that's an eyesore. But again, I don't believe it should be us that's paying to fix it. It's a federal government responsibility. They should be paying for it. In addition to that, out of the blue, I didn't notice it till this afternoon. I got an email from Ruth next door here. I don't know where she is or why, but she couldn't attend tonight. But there were several things in there that she wasn't prepared to support either. So long and the short of it is I'm going to vote against this because I think there's a lot of things in here that we just don't need. And I'm not in favor of. Thank you.
All right, thank you. Again,
Through you again, Mayor Shankar. So when you're applying, can you apply just for the grant money and not indicate that the town would be putting in some money?
We could, but as Matthew advised, these are projects that likely going to be part of the 2024 budget. So it's not necessarily that, I don't think we could easily say that council is not contributing this money. Unless council should deem to not pass the budget as.
When we did a review of the ones that were successful last time, those that were putting in their own money to support the projects were more likely to be approved than those weren't.
they like seeing that. They like seeing that we're gonna go ahead with projects anyway.
I'd express that at the outset, that funding partners want to see a contribution.
Right.
It's very unlikely that they will just give 100% of funding. And some just point of clarification, if I can, just in response to Councillor McConnell's comments, the businesses will pay a fee, a monthly fee for the installation of that barrier fencing. This is not something that will be done complimentary or at the town's cost. It would be recouped through that monthly fee that would be charged to the businesses. If I can, we've done a lot of research in that and what fees are charged. There, it really ranges. As an example, Brockville charges simply $100 a season, and they go in and they do all that work and put all that fencing in at their cost. That's a very low fee in comparison to some other municipalities that we've researched. We would be looking at somewhere in the area of probably $50 to $100 a month, which I believe is right on par with what most municipalities are charging, but certainly not free to the business.
Very good. Councillor Campbell.
Here we are, through you, Mayor Shankar. So if you got partial money from them, could council come back and decide which projects would be of more benefit to the town if we got less money than what you're asking?
Yes, at that point, I think Councillor Young just posed a very similar question that we would just renegotiate that fund. If council didn't allocate that full matching funding and we had to come back with and say, we'd like to make a reduction here, there, or here, there's certainly openness to that.
Councillor Brennan.
Just one more comment. With the barriers, it's more of a partnership. with the business, right? It's more of a partnership. And I see the patios in Brockville, they're packed all summer long. And it's just not Brockville residents. They come from all over. So you can, say it's for tourism and economic development and, it's a big draw.
And that's something I really didn't, go into, which we absolutely would in the funding application is demonstrating the why. Why are we doing this? And we're doing this because it is a placemaking initiative. It is going to animate your downtown. A vibrant, active, thriving downtown attracts more residents, more business, more visitors. There's no magical, it just does. That's how it works. You come through a community and it seems alive, you want to spend time there. And the more we can do to activate these public spaces, create traffic calming elements as well. And that achieves that, having patios and things like that, that make people slow down and look. Also makes you take a look around at the other businesses and the architecture and all of the great assets that this community has and is worthy of giving your time to. That's the real intent of all of this is placemaking. And I know it's this fluffy word but there is a real purpose to it and it will turn the economy around eventually. The more council supports these placemaking activities, the more investment it brings into the community. It's simple.
I know during COVID, there was a lot of discussion because you could only eat outside,
Mhm.
right, or in open space. And I remember going to a few restaurants that were back then, and they had no desire for this. Which is nice that these two new restaurants see that this is an avenue for them to keep busy. So that's good. I like that. I didn't know about the partnership. That's great news. Thank you. More questions?
Yes, please, through you, Mayor Shankar. So you haven't indicated the tree costs, which if it's part of this, I would love to see it in the application.
Absolutely. All costs would be included in that application, certainly.
Okay, but that's not mentioned.
For what specifically?
The trees and the planters.
So the trees would be included in that $5,000 cost for the mural, those street trees.
Okay. Will there be more than 2 trees?
Probably not for that space because it's
Okay.
not a huge space.
Okay.
But we would certainly for the promenade, the planters are included here and that would be there would be some detailed costing for all of those included in the application for sure. Same with the Coast Guard as well. As detailed as we can.
Thank you, Ms. Valentine. No more questions, Ms. Valentine?
No, thank you.
I'm gonna call the question. All in favor? Opposed?
Sorry. Wait, no, sorry. I'm in favor, but it's for her to make the application, right?
That's
Okay.
that's the recommendation.
Okay, thank you.
Opposed? Councilor McConnell? Carried. Thank you. Okay, item 13 is resolutions. We have a resolution under 13.1 for the BIA Board of Management appointments. The recommendation reads that the council appoint the following members to the Prescott Business Improvement Area Board of Management for the current term of council ending once a new board is appointed. Cindy Castleman, Belinda Ballantyne, and Holly Patnode. Can I have a mover and seconder for discussion? Councilor Burton, Councilor Young. Do we need discussion on this? No. Let's call the question. All in favor? Great, thank you. Belinda Ballantyne? Very, thank you. Is that Belinda Campbell?
No, Best of Farmers Market.
Okay.
Yeah, is their business. And then Cindy Castleman is Cozy Closet.
Yep.
And Holly Patno is Tooth Goals, which is located in the Glitz development.
Okay, thank you. So that's carried. I'll sign that. There's no bylaws tonight. There's no new business. Any new business? No? No notices of motions this evening. We do have a proclamation tonight. Today, item 17.1 is National Epilepsy Awareness Day for March 26. Whereas Epilepsy Southeastern Ontario is promoting National Epilepsy Awareness Day, and whereas Epilepsy Southeastern Ontario is a registered charity providing support services to people with epilepsy and their families, and community education services to reduce the stigma associated with the disorder. And whereas epilepsy is a chronic neurological disorder with no cure, which is frequently seriously disabling. And whereas epilepsy profoundly affects the quality of life of over 74,500 individuals and their families in our community and surrounding rural areas. And whereas the citizens of the town of Prescott are encouraged to make an effort this month to learn more about epilepsy, fight stigma, and wear a lavender ribbon to show support. Now, therefore, the Council of the Corporation of the Town of Prescott does hereby proclaim March 26, 2024 as National Epilepsy Awareness Day in the town of Prescott, dated today, March 18th, 2024. All right, so there's no media, no closed session, therefore no rise and report. 21 is confirming bylaw, that bylaw 12-2024 being a bylaw to confirm the proceedings of the council meeting held on March 18, 2024 be read and passed, signed by the mayor and clerk and sealed by the seal of the corporation. Can I move her and seconder? Councillor Young, Councillor Campbell, all in favor? Carried, thank you. We're in a bit of a dilemma tonight because my adjourning mover isn't here today. So I'm stuck.
I could do it on behalf of Councillor.
All right.
It will be a chore, but I will do my best.
I love it. Okay, recommendation is that meeting be adjourned to Tuesday, April 2nd, 2024 at 6 p.m. The time is 8:01 p.m. Moved by Councillor Burton, thank you. Seconded by Councillor Young, all in favor?